Hello and welcome back to part two of the skeletal system video. So what I want to do in this video is kind of talk a little bit about fractures starting out, and then we'll wrap up talking about um, how calcium is controlled in regards to homeostasis inside the bones. So depending upon the book you look at, there's lots of different ways to classify fractures. Um, so these are some ways that you can classify fractures. So you can classify fractures based on the position of the ends of the bones after a fracture. So for example, if you have a fracture where the bones are non-displaced, um, that means that their ends retain their normal position. So if the bones are out of normal alignment, we call that a displaced fracture. So completeness of the break can also be another level of way that you can classify bones. So complete fractures are where the bones are broken all the way through, and incomplete fractures are where the bone is not broken all the way through. So, and you can also classify another kind of way to classify fractures is whether the skin is penetrated. So that you can have open or compound fractures where the skin is penetrated, and closed or simple fractures where the skin is not penetrated. Like I told you before, there's lots of different ways you can classify these bone fractures. They can also be classified based on the location of the fracture, the external appearance, the name of the break, and even some of them are even named specifically after people who describe very specific kinds of fractures. I'm going to show you some different ways to look at fractures or classify them. It depends on the source, but this is just one source that shows some different kinds of fractures. So in a green stick fracture, you basically the bone is basically fractured in one side and then is bowed on the other side. And this happens oftentimes when you have the flexible bones of a young child. They'll break on one side and then flex on the other, and that's called a green stick. Spiral fracture is where you have basically a spiraling kind of a way that the bone is fractured down. Comminuted fracture is where it's just crushed and splintered into various pieces. This one happens to be a transverse, which is straight across. Compound, so it's broken through the skin. And then compression fracture is oftentimes what you get when you have osteoporosis, but the gravity pulling down causes the weakened vertebrae, the body of the vertebrae there, just to collapse down on itself, and that's called a compression fracture. We oftentimes see these in older people or people that have falls. You can oftentimes have compression fractures. So here is just an open fracture. You can see it's penetrated through the skin. Now you notice that the bone's really jagged there. A fractured bone is a very serious event. Sometimes these little fractures will sever arteries. So if there's an artery flowing through here, those little severed jagged parts can cut that artery and cause internal bleeding to occur and possibly death. I think it's kind of cool to look at this x-ray here. You can see the compound bone, medullary cavity. So it's kind of interesting looking there. Here's a comminuted fracture, just splintered into pieces. Oftentimes we have to use pins to place and plates to put those back together and let them heal. So this is what it would look like under a X-ray. So this is a green stick fracture. So you have probably the force came from this way and caused the breakage on this side of the bone, but it flexed on this side of the bone. We oftentimes get that in people that are young. And then if you look at this x-ray over here, you can see they still have the epiphyseal plates. So this person's still growing. And here's your green stick fracture right there. So this is just an impacted fracture. So we have a downward impaction and a little piece of bone splintering out. So the force could come from different directions, but it could have come from this way, broken a piece out, and then you have bones that are coming down inside of other bones. So that's what an impacted fracture might look like. This is a Potts fracture. It's a very specific one where you break the tibia and then tear the you break the fibula and then you tear the connections of the tibia. In coles, coles is where you essentially break down here the radius, and it's named after a person. So it's just a very specific type of fracture. All right, so we do treat fractures in different kinds of ways. And one way is reduction. This is the realignment of the broken bone ends. And we can have an open reduction and a closed reduction. So in a closed reduction, the physician manipulates the bone in the correct position through the skin. In an open reduction, we have to use surgical pins or wires to secure the broken ends. Immobilization is also part of the treatment. You will put a cast. That cast can be a hard cast or a soft air cast. Sometimes we have to put traction for healing to occur, where we take and raise or elevate and take stress off of the fracture. So that's part of the treatment of healing this. So, immobilization is going to depend on the severity of the break, the type of break, age of the patient. All these things will factor into that. So in regards to how a bone heals, it's pretty amazing. But the first thing that occurs when you have a fractured bone is that these torn blood vessels here are going to leak blood. They're going to fill this whole area with blood, and you'll get clots that will form. It will be swollen. You can see the swelling here. It will be inflamed, and eventually a hematoma will form. Just a hematoma is a fluid is an area where blood collects and fills, and so if you've ever had a fracture, maybe you noticed the swelling and the hematoma that formed underneath. So kind of in a second stage of bone healing, you'll have a fibrocartilaginous callus will form. So you can see that material fills in that space there. You get capillaries that grow. You get phagocytic cells that come in, like macrophages, that will eat up all the debris. There will be collagen fibers that fibroblasts will secrete, and then you'll get bone reconstruction, and eventually the fibrocartilage callus will be replaced. So within a few weeks, within a week, excuse me, you'll get turbiculae that will form. That will be within that will be spongy bone within that fibrolaginous callus, and eventually the little callus that forms will be converted full blown into spongy bone, and then in about 2 months the union will be complete. And then eventually you will get compact bone that will be laid down on the sides. A lot of times the compact bone will be thicker than it originally was. So sometimes you can take an x-ray of a person and see if they have a bone break by looking at a thickening of the compact bone in various bones. So looking at the composition of the bone, you can see that most of the bone is going to be collagen. So we have a huge amount of it is just collagen. Calcium makes up the largest portion of the bone, and then you get potassium, sodium, calcium, carbonate, phosphate. These make up the other inorganic compounds of the bone. Bone will contain 99% of the bones of the body's calcium. It'll contain 35% of the sodium, 4% of the potassium, 50% of the magnesium, 80% of the carbonate, and 99% of the phosphate. So bones really store some really vital materials that, through the course of this class, you'll see these vital materials used in other systems and for other purposes. So in regards to bone homeostasis, 5 to 7% of the bone mass is recycled each week. If you look at spongy bone, it's replaced completely every 3 to 4 years, and compact bone's replaced every 10 years. So your skeleton is completely remodeling and becoming different and being reconstructed all the time. In regards to this changing of the materials, you do have bone remodeling or reshaping and bone repair. So So this is accomplished by the surface of the outside of the bone and the surface of the inside of the bone, the periosteum and endosteum. It's regulated by genetic factors and it's continuously done. And we do have feedback loops that will ensure that this actually happens. So in a negative feedback loop, we are going to take and control the blood calcium levels. Once we get the blood calcium levels to the levels that we need, it will shut down the reabsorption of calcium into the blood from the bone. So this negative feedback loop a lot of times will occur because of mechanical or gravitational forces, and it's also, of course, controlled by hormones. So there are many nutritional and hormonal factors that affect bone growth and maintenance. So you have, of course, a lot of nutritional components: calcium, phosphorus, magnesium, iron, fluoride, manganese. These will be minerals that you have to have in your diet in order for bones to be the right hardness. Calcitriol is a hormone needed for calcium and phosphate ion absorption. This occurs in the digestive tract. And calcitriol, you probably are more familiar with its name, vitamin D. Vitamin C is critical for collagen synthesis. If you can't produce collagen fibers, you can't produce the matrix, the actual matrix of the bone, so that those hydroxyapatite crystals will attach to. Vitamins A, K, and vitamin B12 are needed to stimulate bone growth and protein synthesis. Okay, so if you don't have these vitamins, then you won't grow protein and your bones won't grow. Growth hormone and thyroxine are going to be hormones which stimulate bone growth. And then there are sex hormones that stimulate bone growth as well. Parathyroid hormone and calcitonin are really critical to the homeostasis of bone, and we'll talk about each of those in just a second. Okay, so having the right amount of calcium in the blood is really important because your calcium runs your muscles and your bones. If you don't have calcium, your nerves and calcium runs your nerves and your muscles. If you don't have calcium in your bloodstream, then your muscles and nerves won't work at the proper level. So parathyroid hormone is produced by your parathyroid glands. These are glands that are located right behind the thyroid gland, and it's in your throat region. These hormones are going to remove calcium from the bones, and this is regardless to the integrity of the bones. So if your bones are already like osteoporotic, parathyroid hormone will continue to rob the bone of the minerals, even if they're osteoporotic. Calcitonin also may be involved in the control of blood calcium too. It's produced by the parafollicular cells of the thyroid gland, and in high doses, in super high doses, it lowers blood calcium levels. So you can see that it works antagonistically to parathyroid hormone. So bone resorption is accomplished by osteoclasts. These are our bone destroying cells. And these will actually dig depressions or grooves in the bone to break down the matrix. They do secrete lysosomal enzymes. These are little packages of digestive enzymes that they'll spit out and onto the bone, and they'll digest the matrix of the bone. They also have the ability to secrete protons or hydrogen ions, and this converts the calcium salts to soluble forms that are easily absorbed and sent to the bloodstream. Osteoclasts also will phagocytose, that is, they'll eat up demineralized matrix, they'll eat up dead osteocytes, and in the process of transcytosis, where the materials come into the cell, they'll actually move on through the cell and then out of the cell. They send these digested materials into the interstitial fluid, the fluid that surrounds where they're sitting, and eventually into the bloodstream. Once resorption is complete, the osteoclasts will undergo apoptosis or cellular suicide. And osteoclast activation involves parathyroid hormone, but other factors as well. So A negative feedback loop that controls blood calcium homeostasis is controlled by the parathyroid hormone. So if you have a decrease in calcium levels, this is going to stimulate the parathyroid gland to release parathyroid hormone. Parathyroid hormone stimulates osteoclasts to degrade the bone, releasing calcium into the bloodstream. Once calcium goes to the bloodstream, it is going to increase the levels in the bloodstream, and it will go back and shut down the production of parathyroid hormone. So that's a negative feedback loop. So once you get enough of the material you're trying to get, it shuts down the production of the hormone. Okay, so this is just a graphic showing you parathyroid hormone and what it's doing. Parathyroid hormone is going to be stimulated by low calcium levels in the blood, and the parathyroid glands will release this hormone into the bloodstream. It does cause osteoclasts to be stimulated, thus releasing calcium into the bloodstream as it digests the bone away. It does go to the intestine to help for calcium absorption, so that increases blood calcium levels. And it even goes to the kidney and helps the kidney to absorb calcium ions instead of put it in urine. And so calcium is conserved, and so it decreases the loss of calcium to the urine. All of these factors are going to increase blood calcium levels so you have the normal level that you need. If we have high blood calcium levels, the parafollicular cells of the thyroid gland are going to release calcitonin. Calcitonin will decrease osteoclast activity, thus decreasing calcium levels in the blood. It decreases the absorption of calcium in the intestines and causes the kidney to excrete calcium, so you increase the level of calcium in the urine. So all of these factors will go through and reduce the calcium levels in the blood. So you want to maintain a regular level of calcium levels. These hormones help you to do that. So to finalize this lecture, I just want to talk to you about the importance of calcium. Without calcium, you cannot conduct nerve impulses, so your nerves can't communicate with each other. You can't sense things. Your muscles won't contract. You can't coagulate your blood, and you won't have cell division. So these are all functions of calcium, and these are really, really important jobs that calcium does in the body. So, generally speaking, your body has between 1,200 and 1,400 grams of calcium. Most of it's in the bone. It's tightly regulated, and you want a level of it between 9 and 11 milligrams per deciliter. And so you have to have vitamin D to absorb calcium, which means you want to get some sunlight. So the integumentary system is important, and you have to eat calcium in your diet. So with that being said, that will be the end of this particular introductory level. In the next segment of these lectures, we'll talk about the axial skeleton and then the appendicular skeleton and the parts that you need to learn and know. So I hope you have a great day or night whenever you're watching this, and I will see you next time.